The broadcast is now starting. All attendees are in listen-only mode.
Hi, good morning, everyone. Today is Friday, December the 16th. I'm Donna Will, Professional Development Coordinator for the Central Maryland Regional Office of the Maryland Department of Health's Developmental Disabilities Administration. We welcome you to the monthly series of DDA updates with the Deputy Secretary, Bernie Simons. On the panel today, we have Bernie Simons, Deputy Secretary for the DDA. We have Adrienne Holloman, Director of Nursing, Nick Burton, Director of Programs, Nova Evans, Deputy Director of Federal Programs and Integrity, Christy Colbreth, Statewide Coordinator of Self-Directed Services, Robert White, Director of Administrative Services, Jennifer Metrick, Executive Director, Liberty Healthcare Corporation. And before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and phone. And if you look at the panel interface on your right, labeled audio, you can click either computer or phone to switch for the best option. So we have a handout for the webinar, and you can find that in the handout section. And if you are listening by phone, you can request that be emailed. We will be recording the webinar and posting the session on YouTube and the DDA website. Today's PowerPoint has also been uploaded as an attachment and is available for you to download in the webinar panel box. Questions can be typed in the question or chat box in the webinar panel, and we will get to those towards the end of the presentation. So now I'd like to introduce Deputy Secretary Bernie Simons. Good morning.
Good morning. Can you hear me okay?
Yep, you sound great.
Great, thank you. Well, I want to thank everybody for joining our monthly community webinar. You know, I look forward to sharing some important updates today. But before we get started, I want to thank you for your flexibility related to this time change. You know, it's important for us at DDA to be able to accommodate religious and cultural needs to ensure that all of our partners can engage in these important webinars. So we did have a request that Friday afternoons were a challenge for some of those reasons. So that's why we moved the webinar. So secondly, this is our last webinar for 2022, which is amazing how fast the time has gone by. And I really want to wish everybody, you and your family, a happy and healthy holiday season. So on today's agenda, we'll start with the focus areas for the new year. And in addition to that, we've got, as the introductions were done of who's on the panel today, Director of Nurses Adrienne Holloman will be providing some updates on the cold and flu season reminders. And then finally, we've got Nick Burton, Director of Programs, Nova Evans, who's our Deputy Director for Federal Programs and Integrity, Christy Colbreth, who is our statewide Coordinator for Self-Directed Services, and Robert White, who is also our Director of Administrative Services. And they'll all be providing updates as we move forward. Next slide, please. So as we close out 2022, our focus areas for the new year should be familiar, as they are the core drivers of the collaborative work we've been doing with everyone. And we're grateful for your ongoing partnership in these critical areas. With CMS, obviously, we've got the final rule setting that's going into effect on March 17th of 2023, not that far away. And we realized that finalizing our training around the CSQ, as well as releasing our other finalized CSR guidance is there. I want to thank all of you who provided feedback to us on the training and guidance. Extremely important for us to get that feedback. And I want to congratulate and thank all of you for your commitment to ensure that people we provide supports to have the freedom and choice in their home and community. And because of this, you've been very successful. That DDA is currently, and you are, at 100% compliance with the final rule. Outstanding. And so we're also committed to looking at our LTSS expansion. Many of you have been in. It started a while ago with personal supports, and then we've had the early adopters, and the people who started in the beginning of this year. And now, as we welcome the new year, we've got about another 38 providers, and we're going to call that Group 3A, and we'll be kicking that off in January of this next month. And so the department has released some guidance on, enhanced tools to support your transition from PCIS2 into LTSS. So all of these tools are on our website, and we can also share all of this information later today via constant contact. And so we look forward to supporting you in this whole process. And if you're interested in transitioning into LTSS, please reach out to your regional director. I also want to thank all of those folks who participated in our CCS provider collaboration this week. We're committed to ensure that we've got flexibility and, ensuring employment technology. Since we are an employment first and a technology first state now, many of you saw the proclamation from the governor, and it's integral to our conversations around person-centered planning, the whole process, and continued collaboration with our community partners to strengthen and enhance our case management system. And we'll be getting deeper into the dive with UMKC and the NASD recommendations on the PCP in the new year. And then in July of 23, we'll be implementing waiver renewals. Many of you may know that we posted information because CMS said your waiver is expiring on June 30 of 23, and they want it submitted by January next month. So obviously we've had your feedback and engagement on the renewal. And, once we get that submitted to CMS, we'll be sharing with you what their approval is, or if they've got questions, or we'll keep you definitely updated on everything that we're doing. And, as in the past, I look forward to seeing more individuals self-directing their services as a model, and we continue to grow. I mean, I think we're about 2,300 people right about now. We're just around there. And I'm proud of all of the work that everybody's done with this model, and giving the opportunity to people to self-direct their services. Finally, we'll continue to encourage everybody to ensure quality outcomes for people through our quality improvement organization. Jennifer Metrick is on later today, and I look forward to the opportunity we have to strengthen everything we're doing. Okay, so with that, next slide, please. And I believe, Adrian, you're up.
Yes, good morning. I was trying to unmute. Hi, good morning, everybody. Thanks for being here, and I hope you're having an amazing Friday. So the Maryland Department of Health reminds us that reducing the spread of respiratory illnesses like the common cold and flu this fall and winter is more important than ever because of the COVID-19 pandemic. 3 things we want you to keep in mind. Number 1, get your flu shot. The CDC reminds us that the most important way to prevent the flu is to get a flu shot. The flu vaccine has been shown to reduce flu-related illnesses and the risk of serious flu complications that can result in hospitalization or even death. People at higher risk of serious flu complications include young children, pregnant people, people with certain chronic health conditions like asthma, diabetes, or heart and lung disease, and people 65 years and older. Secondly, you want to practice good health habits. Habits such as avoiding people who are sick, covering your cough, and washing your hands often can help stop the spread of germs and prevent the respiratory illnesses like the flu. And thirdly, contact your primary care physician if you have symptoms. Some of the symptoms of the common cold and the flu and COVID-19 are similar, which makes it difficult and hard to tell the difference without diagnostic testing. Studies have found that flu antiviral medications work best if started within 2 days of getting sick. The medications will make the flu symptoms milder, shorten the duration of the illness, and may prevent serious complications. Next slide, please.
Thanks, Adrienne. Thanks for the reminders, and especially as the holidays are approaching. No one wants to be sick this time of year. So I'm Nova Evans, and I'm going to go through the next couple of slides. So next slide, please. Okay, so this is Appendix K Flexibilities and Unwinding. So this slide provides updates on the Appendix K Flexibilities and Unwinding. Under Secretary Schrader's leadership, the current scope of the Appendix K Flexibilities will be extended through June 30th, 2023. This slide includes a chart with the flexibilities that are being extended. The Appendix K and Executive Orders Flexibility Chart, memos, and at-a-glance documents have been updated and are posted on the DDA website. Next slide, please. So this slide is an update to the recent Appendix K revisions to CMS. The revision is to end Appendix K related residential retainer days on September 30th, 2022. This will provide opportunity to access residential retainer fees up to 18 days per calendar year under the normal waiver authority. It's to clarify that additional reasons for rate increase due to isolation. For example, the participant is symptomatic, awaiting test results, and discharged from a hospital. Clarify that staff training related flexibilities continue as per the unwinding strategy. And it increases reserved category slots. CMS shared questions related to the recent Appendix K amendment, and the Maryland Department of Health submitted a response, and we're awaiting further information. Next slide, please. So this slide is an update to the waiver renewal. The Maryland Department of Health's Medicaid office, the Office of Long-Term Services and Supports, is reviewing the waiver renewal proposals currently. Once submitted to CMS, the DDA will post track change documents and a stakeholder summary. Based on public input, we are withdrawing the proposals to decrease Community Development Service, or CDS, group size up to 3 people. So CDS group size will remain at up to 4 people. We're also withdrawing removing new requirements for the use of the Health Risk Screening Tool, HRST, to determine assessed need for 1-to-1 and 2-to-1 dedicated supports or enhanced rates. Other waiver revision recommendations will require CMS approval before implementation on July 1st, 2023. Next slide, please. So now I want to talk about the new DDA stakeholder input process. The DDA is committed to seeking input on policy proposals from participants, families, coordination of community service agencies, community providers, and advocacy organizations. The DDA will post proposed policies for stakeholder feedback to a new dedicated webpage. Stakeholders will have 10 business days to submit their input from the time a proposed policy is posted, and then the DDA will summarize the specific recommendations from the public and responses, which will be posted with the final version of the policy. Next slide, please. So our first focus is on the waiver support service policies. Our goal is to share 2 policies every 2 weeks, starting in January. It is important to note that policy proposals will be based on current approved waiver services, so not the proposed waiver. And remember that DDA cannot make changes to policy that do not align with a federally approved waiver application. So the proposals will also use plain language to make information clearer and more accessible, and changes noted in the renewal will be updated next spring prior to the July 1st, 2023 implementation date. Updates to policies, including meaningful day, residential, and other policies included in policy stat, will occur annually or sooner if revisions are necessary. Minor updates may not be posted if no changes to content, like spacing, grammatical changes, etc. And as always, in the event of an emergent policy decision, this process may not be used at the discretion of the Deputy Secretary. Next slide, please. This slide includes some questions and answers related to the DDA stakeholder input process. Stakeholders interested in being part of the policy-making process can visit the new DDA stakeholder input page, which we'll show on the next slide, where policies are posted to provide your feedback. And steps to submit feedback are listed on that webpage as well. We included a link to the page on this slide. Stakeholders will know when the public comment period is over, as the due date will be included on the initial communication and on the webpage. The DDA really values your feedback, and all feedback will be considered. A summary of public comments, as I said before, will be posted when the final policy is published. Next slide, please. Okay, so this slide shows the DDA stakeholder input webpage. To access this page, you can use the left navigation panel and click on the Policies, Regulations, and Forms link where the arrow is pointing to. And you will be able to click on this link. This will take you to a page with a direct link to this policy stakeholder input page, and all the information will be there as well. So now I'm going to turn it over to Christy to share some updates on self-directed services.
Good morning, everyone. We are really happy to share with you today that 99% of people self-directing their services made an active, informed choice of their new FMCS agency. Participants, with the support of their new FMCS and team, are receiving information, assistance, and training to onboard employees and vendors to the new FMCS processes. Electronic Visit Verification, or EVV, will be implemented on January 1st for people who self-direct their services. We had great participation yesterday during the DDA Self-Direction EVV Lunch and Learn. The Lunch and Learn webinar and the self-directed EVV guidance will be posted on the DDA Self-Directed Services dedicated webpage for viewing or reviewing that information that we shared. As noted during our webinar and in our guidance, there will be a 6-month transition period to support people to learn and use the FMCS systems. We look forward to the new year. One of our self-directed focus areas will be to create new self-directed stakeholder training models. It's something I'm very excited about. These new training modules will include an introduction to self-direction and topic-specific information for participants, teams, CCSs, and support brokers. Next slide.
Thanks, Christy, for those important updates regarding self-directed services. Can you go to the next slide, Donna? I just want to provide everyone with some program team updates. So first and foremost, I just want to thank everyone, as Bernie said, for coming to the CCS Provider Collaborative. I think that was a great first step in us having more engagements like that to talk about topics that are important to our system. And I look forward to continuing to partner with all of you to make those happen. Just a couple things. We're going to make sure that these slide decks are available, and we'll also make sure that any questions that were submitted for the folks that were online are also answered through our FAQ process. With the holidays coming up, just give us a little bit of time to do that, but we'll make sure we get that information out. And then again, if there were any other questions or comments regarding the collaborative, please feel free to reach out to me. Happy to follow up with you. But again, we will be releasing the documents that were utilized and the follow-up, as well as the actual recording of the event, so that if you didn't get a chance to watch it, you will be able to go back and review it. So again, thanks so much for all that. I thought it was a great day. Along those same lines, we were communicating that we are going to host a person and family forum. And I just wanted to let you know that we are moving forward with that in the new year. And we will be communicating kind of next steps, what that's going to look like, what the topics will be. We'll be communicating that via constant contact, and we'll also be engaging with people and families and utilizing the resources that we have to make sure that that's a meaningful opportunity for people and their families. So stay tuned in the new year. I'm going to be working closely with Marianne Kane-Brushy, our family support coordinator, to get that up and going. And I appreciate many of you that have reached out to give input and thought to what that can look like. And we will definitely be leaning into those ideas as we move forward in the new year. I also want to let you know that you all received a constant contact yesterday regarding the launch of our provider directory, which is live on our website today. So that's super exciting. I think it's going to be a great opportunity for people to log in, go in, see what providers are available, what supports they can offer them. I think it's a really great step in terms of offering choice. So I think that's going to be really neat. Certainly, if you have not created a profile yet and you are a provider organization, there was a link to go ahead and show you how to go up and do that. There's a tutorial. You can also reach out to our statewide provider service director, Leslie Thompson, if you have any questions about that. She's always happy to help with those things. Next slide.
Hello, good afternoon. Whoa, it's not afternoon. It's been a long morning, but good morning, everyone, and season's greetings. And thank you, Nick, for that update. So I'm going to give a few updates related to administrative services before I turn it over to Jennifer Metrics to give a quick update on where we are with the QIO. So first and foremost, next slide, please. We're very excited to announce that we have a few new faces in administrative services within the DDA. Nicholas Gabor, who is our new Director of Finance, as well as Dr. Matthew Ogumbukola, who is our new LTSS Program Manager. Nick Gabor, or Nick G, as we like to refer to him. As you know, we have a few Nicks within the department. He spent the last 8 years working in finance. He is a graduate from the University of Maryland, College Park, with dual degrees in finance and management. Nick joined the Developmental Disabilities Administration to continue to use his skills in finance to make a difference to those in need and to have an impact in his home state. Dr. Matthew Ogumbukola is an expert project program and portfolio manager. He's been managing high impact and high visibility projects for the last 20 years. He is also a certified project manager and adjunct professor of business and ethics at Anne Arundel Community College of Maryland. Both Nick and Dr. Ogumbukola have already made an impact in their respective areas of expertise, and we are very pleased that they selected us as their next opportunity. Next slide. Okay, so the department and DDA have been working together to ready for the upcoming launch of the Rate Review Advisory Group. We sent some suggested meeting dates to members of the Rate Review Advisory Group, or RRAG members, yesterday. And once those dates are finalized, we'll get them posted to the RRAG site. In the coming session, we will continue to work together to identify rate priorities and to move forward the recommendations for the general ledger data collection. We want to take a moment to thank and appreciate the providers who have contributed to the pilot to collect the general ledger cost utilization data from providers. The use of a standardized template will help to ensure consistency with data collection across providers, and will provide the foundation for a more informed rate development process in the future. And so with that, I'm going to turn it over to Jennifer Metrics from Liberty Healthcare so that she can give us an update on QIO.
Thank you, Robert. Good morning, everyone. As mentioned, I'm Jennifer from the QIO, and I'm going to be talking with you today about a few updates and activities that the Quality Improvement Organization is undergoing. As many of you may remember from previous webinars, the department contracted with Liberty Healthcare Corporation to develop the QIO in support of DDA's journey towards person-centered excellence within the system through data collection activities and quite a few continuous quality improvement activities. So that's what we'll be giving a quick update on. So you can go to the next slide. So as you may remember, we have 3 core areas of our scope of work for the QIO. We have the data collection component around the Council for Quality and Leadership's network accreditation process. We have our national core indicator surveying, and then we also have waiver assurances monitoring, which also includes utilization reviews. So we'll start with some updates around CQL. So many of you may have participated on November 28th in the CQL Network Accreditation Overview webinar. We had over 250 participants that day, which was excellent. If for some reason you missed the webinar or you want to go back and listen to the information again, there is a YouTube recording of the webinar that is right now hosted on CQL's website on the Maryland specific page. We will also be sending it out through Constant Contact to the full DD community so that you have an opportunity to hear information around what does network accreditation mean for the state of Maryland, how is it going to impact people receiving services and their families, and how does it really help us on this journey towards reaching person-centered excellence. So there's a lot of great information on there. Also, there's some next steps in terms of the data collection that the QIO will be doing as part of network accreditation, where we'll be coming out and doing basic assurance reviews. Those are on-site provider reviews using the CQL data collection tools, as well as the personal outcome measure, where we'll actually be able to talk with participants about their outcomes and support for their outcomes. So those activities will be happening later this winter into the spring, and there will be more information shared around that as we get a little bit closer. The next set of activities that we have been participating in is the National Core Indicator Surveying. So there's 2 main components of that. We have been able to connect with many participants that are receiving services as part of the in-person surveys. So those can be done remotely or face-to-face in person, depending on the choice of the participant. We have connected and scheduled with over 60 participants so far in the last few weeks, and we've completed over 20 interviews with participants. They're going really well. We've also just recently started sending out communication to people's CCSs in case we haven't been able to connect with them. We want to make sure everyone has the opportunity who was selected as part of that sample to be able to participate in one of those interviews. So we're trying all kinds of strategies to make sure that we're connecting folks to hear their voice. We also launched a family and family guardian mailed survey. And so that went out to all contacts of participants who were listed as family members or guardians. That went out through a letter with several different ways that they could participate in a survey. There was a QR code, there was a web link to be able to participate in the survey online. There was also a 1-800 number that family members could call if they would like a paper version of that survey. So if for some reason you're a family member or family guardian and you haven't received that, please connect either with your CCS or your regional office or directly with the QIO, and we will make sure that we get you that survey so you can participate. And then finally, related to our waiver assurances monitoring, that monitoring covers several different areas, everything from ensuring a quality person-centered planning process to eligibility process, to continual monitoring of service delivery and utilization reviews, health and welfare reviews, all of those components, ensuring that the waivers are operating as they're intended and outlined in our 3 waivers is part of the evaluation work of the QIO. So right now, we are in the process of piloting a few TCM or targeted case management. Those functions, our CCSs, are playing within our system. There are a few reviews that are happening right now in a pilot version. So we're looking at fully developing our tools and processes, and this is an opportunity to be able to gain that feedback to finalize those tools before guidance goes out and those tools go live in this winter in the coming month or so. And so that's where we're at with our TCM reviews. And then we also have a utilization review pilot that is just about to launch. So we had 5 providers step forward to be part of that pilot. This is a pilot around ensuring financial accountability within the system and ensuring that there is service documentation to support services that are billed and paid for. And so those that are participating in the pilot are gathering service documentation to share with the QIO. And then we will be using a set of criteria to determine, based completely on the service authorization and billing guidance that has been distributed by the department, looking at documentation supporting those paid services. So next up, we will be further developing our health and welfare reviews, as well as the CQL basic assurance process and qualified provider reviews, and we will be sharing that information in the coming months. So thank you very much, and have a great Friday. I think next up is Deputy
so this slide is obviously the link when you can, register and share with your colleagues, families, and participants. And, after you register for one of our webinars, you receive a confirmation email containing information about how to join, etc. I want to thank everybody who's here today. And now we are going to go into the question box and answer any questions you might have heard about what was on the webinar today. So again, thank you. And if I don't have an opportunity, a happy and healthy holidays and have a great weekend.
Thanks, Bernie. We just have a few questions, actually. And the first one I'll go ahead and take. The question is, if HRST will not be used to assess the need for one-to-one, what other ways will be used to assist in determining the need? So that's a great question. The DDA has a variety of tools to support teams in identifying need. Certainly the HRST is one tool, but there also is team conversations. There's also the life course tools. There's also the CIS. There is also behavior tracking, medical tracking, support tracking. There's professionals in each person's life. And so it's the opportunity for teams to really kind of look at what the need is and have a conversation about what that need is, and then make sure that that need is clearly identified in the person-centered plan and any applicable documents. And if you have any questions about that, don't hesitate to reach out to your regional office for some support. they can help with those kind of questions and kind of help the team in kind of thinking about what that might look like. Christy, this question is for you. In terms of people receiving EVV login information, what was kind of the expectation, or when should people be receiving that, and who should they reach out to if they haven't received it yet? Nova, are you with us?
Yes, I'm not sure if Christy's on the call, but all the FMCSs should be reaching out with information about their EVV logon information. So that should be happening now. With any of the FMCSs, they also have customer service lines you can contact. And I know that that information, that contact information, is in the webinar that was shared yesterday. And so I would reach out to those folks of your chosen FMCS. But if you haven't received that information, it should be coming any day now.
Thanks, Nova. I appreciate that. Okay, let's see here. This is let's see. The next question, I think, is for the waiver. Thank you for the waiver application changes you made that communicated today. CDS and one-to-one justification remaining as they are now. These are important for preserving needs, services, and supports for people with IDD and their families. Look at that, Nova. It wasn't even a question. It was just a thank you.
Good to hear.
There you go. Right. The next question, or I guess statement, was that most people today did not have a login. We have a pretty high attendance, so it looks like a lot of people did have a login, and it looked like 514 people were registered. And I know a notice did go out this morning in regards to the registration. So if you didn't receive that, please reach out to Donna Will just to make sure that you were registered. Let's see. Nova, this one is for you, and I think we've talked about this one before. Can you confirm the 18 vacation days will be per calendar year, so they will start over in January?
Yes, that's correct.
Okay. And it looks like there was a clarification to the login today. It looks like that was for FMCS. So we will certainly take that back with Christy and Nova and have a conversation about that. So thanks for alerting people to that. Let's see. Robert, this one's for you. I received our backup documentation for the first 10% ARPA payment. And looking at the detail, there are DOS that were approved with attendance in PCIS2, but do not show in the calculation in the file. Who should I contact to address this issue?
Sure, thank you, Nick. And it's a great question. So with the backup documentation that went out, we also included a cover letter with additional information. One piece of that information was related to when the file was run. So we ran that file, I believe, around August 8th. So any adjustments or updates that took place after that date will be picked up as part of the reconciliation process. But if you continue to have questions related to the calculation and or the claims used to, quantify the total payment, then please contact Nicholas Gabor. His email address is in the slide deck here, as well as on the in the body of the email that went out along with the details.
Great, thanks, Robert. And believe it or not, that is all of our questions. And a couple of questions about the provider directory link. That's going up. We'll confirm that that's up, but that was going up today. So I appreciate your patience. We'll make sure that that was posted today so that you all have access to it. But I think that is all that we have for questions. So I'm going to turn this back to Donna to go ahead and close us out for the day.
Thanks, Nick. And thank everyone for attending today's webinar and for posting your questions in the question box. As always, we value your feedback and we will review and respond to frequently asked questions by our regular updating of the DDA's FAQ document. Please stay healthy and thank you again for your dedication to our DD community. We hope to see you at our next webinar on January 27th at 10:30 a.m. As the Deputy Secretary said earlier, happy holidays to you and yours, and see you in 2023.